Drug education and other related health problems. So there are drugs and its effect. So what is drugs? Are chemical that affects a person in such a way as to bring about psychological, emotional, or behavioral change. Dangerous drugs are those that have highly tendency for abuse and dependency. This substance may be organic or synthetic and pose harm to those who use them. Drug abuse exists when a person continually uses a drug other than its intended purpose. This continued use can lead to drug dependence, a state of physical and psychological dependence, or both on a dangerous drugs. So commonly abused drugs: first, sedatives, drugs which may reduce anxiety and excitement. Stimulants, drugs which increase alertness and disposition. Third is hallucinogens, drugs that affect sensation, thinking, self-awareness, and emotion, changes in time and peace perception or delusion or false beliefs, and hallucinations may be mild or overwhelming, depending on the dose and the quality of the drugs. Fourth is narcotics, drugs that relieve pain and often induce sleep. So we have dependency and also the addiction. And what is the difference between dependency and addiction? So dependency, it is the state of physical and psychological dependence on a dangerous drug or drugs experienced by a person following the use of the substance on a periodic or continuous basis. A person dependent on drugs will experience withdrawal reactions, also known as cold turkey. It is the symptoms that occur after long-term use of drugs is reduced or stopped after abstaining from drugs. So addiction, it is a complex and often chronic brain disease. It is characterized by excessive drug craving, seeking, and use. Addiction is caused by brain changes caused by constant drug use. So commonly abused substance in the Philippines, we have alcohol. Alcohol abuse is a pattern of problem drinking that results in health consequences, social problems, or both. However, alcohol dependence or alcoholism refers to a disease that is characterized by the abnormal alcohol-seeking behavior that leads to impaired control over drinking. Approximately 2.5 million people die annually due to the excessive alcohol use. It is as of 2011. The Filipinos are also the heaviest beer drinkers in Southeast Asia. So we have the effects. We have the short-term effects, the distorted vision, hearing and coordination, impaired judgment, altered perceptions and emotion, bad breath, and lastly is hangover. While the long-term effects, loss of appetite, vitamin deficiencies, stomach ailments, skin problems, sexual impotence, liver damage, heart and central nervous system damage, and memory loss. We have methamphetamine. The street name are Shubs, Ice, Meth, Crystal or Crystal, Basura or Tawas. So shabu is the most popular and commonly abused drugs in the country today. This stimulant is believed to be the drug choice of 90% drug users in the Philippines. We often see and hear this in the news. A powerful addictive drug causing people to become extremely paranoid and have intense hallucinations. This drug has grown into a 1 billion a day industry in the country, was also dubbed as the smuggler's paradise. So, if we use this thing called shabu, the effects are euphoria, increased heart rate and blood pressure, increased wakefulness or insomnia, increased physical activity, decreased appetite, extreme anorexia, respiratory problems, hypothermia or convulsions, and cardiovascular problems which can lead to death, irritability, confusions, tremors, anxiety, or violent behavior, can cause irreversible damage to blood vessels in the brain, producing strokes. Users who inject the drugs and share a needle are at risk for acquiring HIV or AIDS. So we have the cannabis sativa or marijuana. This drug impairs a person's ability to form a new memories and to shift focus. Getting high or stoned is the reason most pot smokers use marijuana. Many experts also believe that heavy pot smokers are at increased risk for lung cancer. So Kalinga province in Cordillera is emerging as one of the country's top marijuana hotspot. It is considered illegal in the Philippines. So the street names for marijuana are weeds, jutes, jutis, pot, grass, damo or chongki. So the effects or the short-term effects when we use this marijuana: sleepiness, difficulty keeping track of time, impaired or reducing short-term memory, reduced ability to perform tasks requiring concentration and coordination, increased heart rate, potential cardiac dangers for those with the existing heart disease, bloodshot eyes, dry mouth and throat, decrease social inhibitations, paranoia, and hallucinations. Long-term effects. We have increased cancer risk, decrease in testosterone for men, also lower sperm counts and difficulty having children, increase testosterone for women, increase risk of infertility, diminish or extinguish sexual pleasure, psychological dependence, requiring more of the drugs to get the same effect. We also have inhalants. It refers to the substance that can be turned into chemical vapor to be inhaled. It could be the cheap way for people to get high. Examples. We have the gasolines, and rugby is probably the most common in the Philippines. So the short-term effects for inhalants: increased heart rates and blood pressure, sleeplessness and tremors, lack of muscular coordination, sparse, mangled and incoherent speech, decreased awareness of touch and pain that can result in self-inflicted injuries, convulsions, coma, heart and lung failure. The psychological effects are a sense of distance and estrangement, depression, anxiety, violent behavior, confusion, suspicion, and loss of control, flashbacks, and many more. So, common signs of drug abuse and addiction. While every person's experience of drug use or addiction is unique, there are some signs that are common to many people who abuse the substance, including the following: intense craving, tolerance, withdrawal symptoms, physical dependence, engaging in increasingly risk behaviors, drug-seeking behavior, financial trouble related to drugs, neglecting responsibilities, developing unhealthy relationship with those who support addiction, and isolating behavior. So why people use drugs? Ano mo gamit mo yun? First, we have the peer pressure, curiosity, boredom, frustrations, stress, escapism, lack of parental guidance, lack of focus in life. So these are the common things why people do use drugs. So how can we prevent to use drugs? How can we prevent? First, maintain good physical and mental health. Use drug properly. Kita man siguro tanan nakatilaw ng drugs, pero paracetamol, kanang mora yun nato natilawan. Most drugs are beneficial. Beneficial yun siya when used under medical advice. Understand your own self. Accept and respect yourself for what you are. Develop your potentials. engages in wholesome, productive, and fulfilling activities. Learn to cope with your problems and other stresses without using drugs. Seek professional help if you feel you cannot cope with your problems. You can contact your teachers or doctors kung di ninyo kaya. Develop strong moral and spiritual foundations. How can I say no to drugs? Makasturya pa dito nga. No to drug. I say no to drugs. So first, keep your reason simple and honest. You don't have to explain why you don't want to use drugs. Kung naging mamugos. So, next we need to be polite and firm. We need to be strong in our decision nga dili kita magamit. Next, avoid drug users. Choose your friends wisely. If your pairs are real friends, they will accept you whether you take drugs or not. Remember, it is your right to say no to drugs. So why should I say no to drugs? Number 1, drugs cannot solve your problems. Give yourself the chance to be all you can be. Because drugs will surely ruin your future. Di na tumabot ang atong mga pangandoy if atong pasagdaan nga mao ni makaguba sa atong future. Then will totally destroy your mental and physical upbringing. Di na takatarong guna-una. Then lastly, will adversely affect your family. Kinay dako nga kanang pagkahugno sa atong family if they will know nga nagamit tag ani nga drugs.